going to the sites where the women were with the children, and I brought in the Family Planning Center, and I brought in the midwife, and so we could look at educating women, but not from a point of view of being so above the subject. We came in often as the teachers and the professionals, and then we realized that we could probably be more effective by using stories about how we manage our sexuality, how it works when you are pregnant, not just avoid pregnancy, but what happens when you are pregnant and how are those services offered, and then also explaining about the education system so that the mothers who are often handling all of these situations could be informed, and how informed mothers then could help their children find a balance in their new home. After that work, I did my PhD on all my international case studies as a mediator, and then I became a researcher. And I was hired at the state hospital system with funds from public health and national public health situations that were coming through the prevention office. And I worked at the psychiatric hospital for 4 years, doing research for mental health, immigrant health, and LGBT health, because there are high rates of suicide. And so that allowed me to use qualitative research techniques, needs assessment, and appreciative inquiry to then go in and create a network by interviewing, for instance, for the mental health report, 130 people in our canton from diverse professions, and to be able to have ideas and perceptions about from the professionals, and then code that with en vivo and make it into an important needs assessment report that allowed the head of the hospital system to lobby for more money and funding for mental health in our canton. And as you know, mental health is a very big issue and a growing issue. Then I found Creighton, and I've been working with the JWL program and trying to bring Ignatian principles in pedagogy into this online learning environment where we're integrating political asylum seekers and young people in Afghanistan, and trying to use the new technologies to reach out to people in the margins. So when I talk about marginalized groups, it wasn't a choice I made, but it was the interest of our canton to look into these questions, because more and more people are a part of specialized groups, marginalized groups, that need to be understood better so that we can include them in the system in more effective ways. So through this work, I came to realize that I was legitimate as the mediator in the system. I was hired, and so I could ask the question. But as Byron Good says, he's a famous medical anthropologist from Harvard, whoever asks a question also has the responsibility with what they hear. So what I realized is I was engaged in witnessing, and as an engaged witnesser, I often then was taken to another posture, a shape-shifting posture that took me to accompaniment. But I didn't always understand that at that time. I just knew from my heart that I had to support social justice, and I was aware of the suffering, and I had been able to ask the question, and so I was responsible for what we did in our community with that witnessing and knowing of the suffering. So narrations of witness. I became a part of the story. And then I talk about emancipatory processes and pathways, because it's only together that we can find the way forward. And it's not from being on top, being on the pyramid as Dr. Riva or the mediator in the services. It's really the emancipatory process is together for a better world and a better society. And so then in my, for instance, aging research, I integrated the senior volunteers as in tandem pathfinders. And though I can't give them the responsibility of writing the report, please come in. I integrated them in the thinking processes, the focus groups, the World Cafes, and we made a wonderful film that evolved from our conversations, and I gave them recognition in a community setting, and they were part of it in a recognized way. So it's walking with people and finding ways to be in tandem pathfinders. I believe this kind of research is future forming. So we go from being a mediator or being a researcher and analyzing to people who are actively future forming through our methodological processes. And my reference is Kenneth Gergen, who is a social constructionist. And I would say that now, with the gentle guidance of Alex, I've been able to move into this understanding of accompaniment models and understanding how the research we do, the professional positions that we hold, we are also accompanying. And that's an important posture. So, engaging in these different emancipatory processes, we are moving from community-based participatory research toward accompanied research. So I'm sure you've all heard of community-based participatory research, but you're working in the community, you're working with the people, you're using participant observing methods, ethnography, qualitative research, and you're bringing the people into the community to, I know